everyone, so this is Q&A Friday. We've got really good questions today. The first question comes from B, and she asks, "Hi Dr. Connie, I'm trying alkaline keto, healthy, restricted ketogenic diet, realizing I'm in need of good liver, gallbladder, and kidney to continue. Any advice, please? Would you please share your opinion on fat-adapted immune system function in lupus treatment as it got massive effect on mitochondria? Thanks so much." Well, the fat-adapted metabolism we know is much more efficient when producing ATP, which is adenotriphosphate, which is our elemental fuel currency molecule in our bodies. This is why the keto diets are all the rage. However, too much focus on the fat-based diet can be harmful as it can cause an extreme imbalance in our body. So we advocate the alkaline keto version where we're sensible about adding sufficient amounts of healthy vegetables that are high in beneficial prebiotics, fiber, and micronutrients. The problem with this is that you are struggling with an underlying medical condition such as lupus and other autoimmune conditions. Or if you are struggling with those conditions, it can actually worsen the disease by increasing inflammation. If you're detoxifying organs like the liver, kidney, spleen, gallbladder are suboptimal, then such keto or even keto alkaline version diets can wreak havoc. So I would advise you, as you look to the new year, it would make much more sense to reset your body by enhancing your detoxifying organs and cleaning out your body, so much in the same way as we would like a car. So the concept of using foods as medicine is good, but as a clinician, I also know that unless we drastically alter our physiological state, changing diet doesn't make a dent in our condition. For example, we get oil changes in our cars. Imagine putting in the most efficient and clean oil into a car with dirty filters and dirty oil chamber. Such is why I recommend to all my clients and patients who struggle with symptoms and/or medical conditions like lupus to go through an intensive detoxification for an extended amount of time to ensure that you've improved your physiological state. Then, when you do change your diet and improve the way you eat, your detoxifying organs will work efficiently and effectively because you've gotten rid of all the toxins that may slow your healing. We call this the Alkaline Detox Protocol, and we will be hosting a webinar in 2 weeks, so look out for an invite or comment below to sign up. Okay? Second question comes from Lida. And she asks, "Hello, Dr. Connie. I'm new to your group and very grateful to have found you. My first question is this. Can you explain to me how your membership works and how do I make appointments to get treatment started with you? The cost. Can you tell me if taking Plaquenil still causes kidney nephritis? And is it worth taking it knowing the side effects? Thank you." So, hi, Lida. Well, first of all, welcome to our group. And our membership is now a standalone program called the Alkaline Transformation at only $97. It's a one-time change with full lifetime access. And this includes the alkaline diet, exercises that I personally lead you to perform, as well as healthy lifestyle tips and tricks to help you live a healthy life despite your lupus or autoimmune condition. We also offer a $19.97 per month membership app where you can gain access to our alkaline plan on your smart device. You can measure your health progress, have my yoga Pilates-based exercises on your phone to access anywhere. We provide you with the meal plans and guided meditations, and it also syncs with your Apple Watch or Fitbit so you can track your activity as well as your health status or health state. As for my services, most of my patients start with an initial 90-minute functional medical consultation where I meet with you to discuss your detailed history and come up with a solution to begin the healing process. We go over your labs and or order labs necessary as well to provide you with a personalized plan and prescription for your recovery. This can be done anywhere as we offer a telemedicine consult, which is $349. You would make an appointment by calling 678-335-5566, and we will invite you to our patient portal to gather the information about your history, as well as to use it for our consultation. Whatever you decide, you'll find something that you can take away, and I do hope that you decide to join our tribe. The last thing that I want to touch on with respect to Plaquenil. Plaquenil is relatively the most less toxic or least toxic medication for lupus. It's effective in keeping our remission or keeping us in remission. However, if your detoxifying organs or your detoxifying ability in your body is compromised, it can build up in your eye. So you do have to get your eyes examined on a regular basis because it can cause spotty blindness. So it's a yearly checkup with the ophthalmologist is required. A lot of rheumatologists feel very strongly about taking Plaquenil, and I myself have been on it for a number of years, and then I stopped, and then I've been on it a number of years when I went into a flare. So I have mixed feelings about it, but again, it's the least toxic medication for lupus, which is relatively safe, and it doesn't cause nephritis. Rather, it causes potential blinding in your eyes. So I hope that that's clear as to what you should do. I would first talk to your rheumatologist, and how I would help you in determining that would be that I would have to get to know your situation a little bit better. Okay, so I hope that helps. Last question comes from Ice Cool, and she asks this in my YouTube channel, so you didn't see it in this feed, but I'm going to answer this because it's a very good question. She asks, Dr. Connie, I wanted to ask you about early onset menopause and whether you know this could be caused by lupus. Do you have any advice on horrendous night sweats and hot flushes? I am 45 years old. Yes, Ice. Due to the meds that we take for lupus, as well as the inflammation, early menopause is implied for those of us living with lupus. You can take some herbals for your menopause symptoms that can help decrease such symptoms. And if you'd like, I can prescribe some supplements that I'd recommend to my patients. So please email us at info@alkalinewellness.com. On another note, it's not uncommon for lupus patients to be on hormone replacement, specifically progesterone. There are some studies indicating that being placed on progesterone does help lupus patients be in remission. And there is a correlation between lupus with hormones. So there's still yet to be a lot of studies that need to be done in this topic. But if you wanted to talk to your OB-GYN or a functional medical doctor, they can probably point you in the right direction. I hope all this made sense. And if it didn't, please leave comments, and I will see you guys next week for more Q&A.